So today we are discussing about the renal stones, also known as nephrolithiasis. Renal stone occurs due to the supersaturation of the urine. There are the factors that help in the formation of stones, and there are factors that help in the inhibition of the stone. The factors that help in the formation of the stones are calcium, oxalate, phosphate, uric acid, and certain drugs. And the factors that helps in the inhibition of the formation of the stone is citrate. The major factor is citrate. Besides citrate, there is also osteopontin and nephrocalcin. The clinical features of the patient with the renal stone, the most common clinical feature is the abdominal pain. The patient also present with the nausea, flank pain, and the pain that is associated with the renal stone is renal colic pain. If the renal stones are of the small size, then the renal stone pass through the ureter, and this movement causes the contraction of the smooth muscle of the ureter excessively, also known as the hyperperistaltic movement of the smooth muscle of the ureter, develops a certain type of the pain known as the renal colic pain. The patient also presents with the hematuria. Since the ureter is developed from the different source of the development, it also has the different nerve supply, and due to the different nerve supply, if the stone is lost in the different area of the ureter, then is the referred pain occurs in the different parts of your body. If the stones is lost in the upper 1/3 of the ureter, then the referred pain occurs to the testicles if the patient is a male, and labia majora if the patient is female. If the renal stone is dislodged in the middle 1/3 of the ureter, then the referred pain occurs to the iliac fossa. If the stone get dislodged in the lower 1/3, referred pain occurs in the groin region. Renal stones are the different types. The first and most common type of the renal stone is calcium oxalate stone. Calcium oxalate stone is formed due to numerous reasons, and the most important reason is hyperparathyroidism. Still, the reason behind the calcium oxalate stone is idiopathic hypercalciuria. Calcium oxalate stone is formed initially by the deposition of the calcium phosphate at the tip of the renal papilla, and this stage is known as the Renal's plaque stage. Later on, this Renal's plaque developed into the calcium oxalate stone. The calcium oxalate stone is seen in the X-ray, hence it is also known as the radio-opaque stone. It is pH independent stone. And the calcium oxalate stone are of two types, that is the monohydrate calcium oxalate stone and dihydrate calcium oxalate stone. And we need to know the shape of this type of the crystals. If the monohydrate crystal is present, then the shape of the monohydrate crystal is dumbbell shaped, and the dihydrate crystal, the shape of the dihydrate crystal is envelope shaped. Now we move on to the struvite stone, also known as the triple stone. The struvite stone is also known as the triple stone because three elements are present in this stone. The three elements are the magnesium, ammonium, and phosphate stone. The struvite stone is also known as the magnesium ammonium phosphate stone. This is the slow growing stone, and this involves the massive involvement of the renal pelvis. This is also seen in the X-ray, hence it is also known as the radio opaque stone. The most important thing about the struvite stone is alkaline pH of the urine helps to develop the struvite stone. If your patient had the prior infection of the Proteus infection or the staph saprophytic infection, that helps in the alkalization of the urine, hence the patient is more prone for the development of the struvite stone. The shape of the struvite stone is coffin lid shape. Now we move to the uric acid stone, and the uric acid stone occur in the patient of the tumor lysis syndrome or Leishman syndrome. Leishman syndrome is the syndrome in which there is a deficiency of the HGPRT enzyme, due to which there is more production of the uric acid, and the more production of the uric acid deposit in the kidney and helps in the formation of the uric acid stone. And next is tumor lysis syndrome. In tumor lysis syndrome, your patient is suffering from the cancer, and the patient takes anti-cancer drug. And due to the anti-cancer drug, there is the lysis of the tumor cells, and due to this tumor cells lysis, there is more catabolism of the DNA, and due to this catabolism of the DNA, there is formation of the purine. This purine is break down into the uric acid, and due to this uric acid production, there is deposition of the uric acid stones in kidney. The uric acid stone do not have any definite shape. This is not seen in X-ray. This is the radiolucent stone. This is the only stone present in the kidney that is not seen in X-ray. Hence, uric acid crystal stone is radiolucent stone, and acidic pH precipitates uric acid stones. And the next type of stone is cystine stone. The cystine stone, there is defect in the dibasic amino acid transporter, hence there is the increased amount of the cystine in the urine, and hence that helps in development of the cystine stone. The cystine stone, it is defect in the dibasic amino acid transporter, hence the patient is child, and the acidic pH precipitate the cystine stones. The shape of the cystine stone is the hexagonal shape, and due to this hexagonal shape of the cystine stone, they are the microstone. They can come out in the urine, and when it is exposed to air, it gets converted into the green color. Now we can make the diagnosis of this renal stone by non-contrast CT scan. Why non-contrast CT scan is important, and why we cannot prefer X-ray? Because uric acid crystals are radiolucent in nature, and we might miss the uric acid crystals stones if we only rely on X-ray. Hence, the most important diagnosis for the renal stone is non-contrast CT scan. And we may also check urine, and in urine, since the patient is having hematuria, we may see the RBC in the urine, and the RBC are of the isomorphic shape. That is, all RBC have the definite shape.